Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee. Currently, I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with the MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your questions and your comments on Facebook, YouTube, and Twitch. MS navigators are online throughout today's program, answering questions and connecting you to resources. Many people living with MS also live with other coexisting health conditions, referred to as comorbidities. And comorbidities not only have their own impact on your health, they can also negatively impact MS. So treating these other health conditions becomes important to your overall health and well-being and an important part of managing MS. Joining us today to discuss comorbidities and MS is Dr. Ruth Ann Marrie, Professor of Medicine and Community Health Sciences at the University of Manitoba in Canada, and the director of the Multiple Sclerosis Clinic at Health Sciences Centre Winnipeg. Welcome, Dr. Marrie. Thanks for joining us today.
Hi, thanks so much for asking me to join you.
Your research team found that more than 50% of the people with MS experience another chronic health condition over their lifetime. What are some of the most common comorbidities that affect people with MS?
Yeah, so it's a question I often get asked. So there are several, and I think they won't surprise most people with MS. So depression and anxiety disorders are among the most common. And then high blood pressure, high cholesterol, and arthritis are the sort of round out the top five. And I think that reflects the fact that they're common in people without MS, and that many people with MS are a bit older, we know now in the US. And so those are the kinds of things that many of us face as we get older.
I'm going to come back to getting older in just a moment. I'm wondering, though, is there a relationship between comorbidities and MS?
Yeah, so there are a few ways we can think about that question. So one is, does MS increase the likelihood you're going to have other health conditions? We think about it in the opposite direction. And then, does having a comorbidity affect your MS? So our team has spent the most time thinking about how does comorbidity affect your MS? And I think important, many people don't realize that some coexisting conditions affect your likelihood of having a relapse and the rate at which your physical impairments due to MS, as well as the problems with memory and concentration due to MS worsen and affect symptoms like energy level and sleep and pain, as well as quality of life. So lots of important relationships there.
Well, now that you've mentioned how comorbidities can affect your MS, can they lead to disease progression?
It can. So what several of the studies we've looked at have suggested that, for instance, depression is associated with faster progression of MS in terms of sort of disability. So most of the studies have looked at impairments in mobility. So walking ability worsens faster. We've also seen that having conditions like high blood pressure, diabetes, and high cholesterol is also associated with worsening of walking impairment. So we do think it's an important factor in disease progression.
We heard from Nadia. She told us that her MS diagnosis was actually delayed because she also lives with diabetes. And so her fatigue and muscle weakness was attributed to her diabetes. Can you explain why an MS diagnosis is sometimes delayed because of comorbidities?
Yeah, so that's a really important phenomenon. And one of the reasons that people started thinking about that in MS is because that's well known in conditions like cancer. So we have to think about what happens to get from, if I have MS and I don't know it yet, I have a new symptom. How do I get from having that new symptom to getting to my new diagnosis of MS? Well, first, I have to recognize that this is something new and that it's not related to the other health issues that I have, right? So I have to recognize it's not my diabetes that's giving me the new numbness or weakness. And then I have to think that it's important enough to get to a doctor, probably my family doctor. And then I have to get my family doctor to recognize it's not related to my existing condition and that it's more important than whatever else is going on with me, and to make that referral. And then I have to get to the specialist, so usually the neurologist. And then the neurologist has to say, oh, well, wait a minute, I've done your MRI. There's some abnormalities on your MRI. Are those due to MS, or are they maybe due to diabetes? Because we know that diabetes or high blood pressure can also cause abnormalities on MRI. And so that might mean that we needed to do extra tests to be confident. So we have a series of steps. So it's very common, if you have an existing health condition, for someone to say, oh yeah, that's your existing problem, and not to want to introduce a new condition. And in fact, physicians are often trained to think of one explanation instead of multiple. And so we tend to orient that way. And it would be pretty easy for a person with diabetes to also think that some of their conditions happen that way. So it's what we refer to as misattribution, right? So we're pointing the symptom to the wrong thing. The other possibility is sometimes you're having so many health issues with your existing conditions that people are really focused on dealing with those, and they kind of put the other stuff in a box for a while because they, it's basically competing demands. You can only deal with so many things at once. And so putting all those things together at each of those steps in the pathway can lead us to potentially lengthy delays.
A moment ago, I know you made mention of age having an impact on MS and an impact on comorbidities. We heard from Karen, who just turned 60, and that's exactly what she was wondering. Does her age impact MS, and is it a factor in developing comorbidities?
Yeah, so I'll answer the first part first. So when we get older, all of us, whether we have MS or not, are at increased risk of other health conditions. And so the most common ones that we see occurring with age are sort of high blood pressure, high cholesterol, diabetes, heart disease. These all increase in frequency with age, arthritis as well. And so we see a similar kind of pattern in people with MS. So over half of people with MS over age 60 will be living with high blood pressure. And so that gives us a few reasons that age can affect MS. So when we get older, there are many biological changes that happen to us. So our immune system changes, the brain's ability to repair and regenerate and deal with sort of prior damage decreases. And so that's important in a condition like MS, or we've already, by age 60, you may have accumulated, lots of existing damage. So our basic sort of reserve or capacity to manage any damage that's occurred before tends to go down as we get older. So immune system changes, repair capacity changes, and then if we layer in getting new health conditions with age, we end up getting a lot of potential things that can influence how a person with MS feels when they're older. And so things may feel like and may change quite rapidly as we get older.
Our next question also references something I heard you, begin to talk about a little bit. We've heard from Beth. She's living with MS, and she was diagnosed with breast cancer 2 years ago. And Beth says at first she had a really difficult time managing both her MS and the cancer. She was nervous about having treatments for both and wants to know how should someone handle multiple treatments, and are there situations where one diagnosis takes priority over the other?
Yeah, so that's a common situation that people with MS face, particularly as they get older. So there are a few things that I think it's important to do. So one is you need to have a pretty good idea of the whole list of conditions that you have. And you need to make sure that every provider you're seeing knows about all of those other conditions, because it's really important that they can keep that in mind when they're trying to make recommendations specific to you. Because there are times when we have choices of different treatments, and you might choose a different therapy to ensure that maybe you could use one treatment to manage two conditions, always ideal to, have fewer treatments on board. Or a particular medication might be something that's unsafe to use because of another medication or condition that you already have. So you might make, different choices. So I think, having those conversations at the time that somebody says, listen, we need to treat you for this, making this recommendation, whipping out and like, I have mine on a piece of paper so that I can show it to somebody, is like, okay, how does this affect what I'm already doing for my other health conditions? So do we need to think about it differently? Is this going to be okay with these medications? Do you need to make sure you send a letter to my other doctor to make sure they're actually fine with this? And so that's going to be for kind of the everyday kinds of things, the high blood pressures, the diabetes, cholesterol kinds of things. If you have a cancer diagnosis, which is a more serious, life-threatening condition potentially, then the conversation tends to shift a little bit more in that, typically when I see patients in that situation, we really prioritize the life-threatening condition. And so what we try and figure out is helping the cancer doctor figure out is if there's anything different they need to do so that we don't worsen the MS. And what can we do in terms of MS medications to try and reduce or eliminate things that may make it unclear for the cancer treatment plan, whether there are side effects due to the cancer treatments or safety issues. So we try and make it easier if we can to treat that cancer condition and be, available to help manage that. So I do think there are, if something's life-threatening, that has to be at the top of the list for things. When it's not, then you have a bit more time to work through that plan and figure out of the available choices, how can you optimize it? This does, as you can imagine, mean that I like to think about prevention so that people maybe don't have to get into this situation at all, because it's a lot of work to try and deal with multiple doctors and conditions and treatment plans.
You've been involved in research studies that found that depression and anxiety are prevalent disorders that occur alongside MS. Why are these two disorders more common in people with MS?
So that is a question we're trying to sort out. So anytime you see a condition being more common in somebody with another condition, you can kind of make yourself a grid of possible answers. So you might say, well, maybe they have a risk factor in common. So is there a gene or set of genes that's associated with the risk for MS and depression and anxiety disorders? Could there be a life exposure, like smoking or childhood trauma that's associated with those things? We might ask the question, does MS itself cause those disorders? Or we could reverse that idea. Or is it just random chance? So we need to sort of work through that systematically. So one of my colleagues recently took a look at the genes that we know are associated with MS and depression and found that they actually weren't related with each other, but instead found that genes associated with a higher body mass index, which is a measure essentially of our fat tissue relative to what it should be, that was associated with both MS and depression, suggesting that there is a genetic link, just a different one than we actually thought of when we started that study. And some other recent studies have suggested things that childhood experiences, like if you experienced abuse or neglect as a child, that may increase your risk for both MS and having depression or anxiety disorder. So that suggests there may be some risk factors in common. But I think it's also likely, we know that MS affects the brain, and depression and anxiety disorders are also brain diseases, even if many people in the general public don't think of them that way. And so there are some studies suggesting that if you have lesions or areas of damage in your brain because of MS in particular locations, that increases your risk. So I think what we find, much like we say MS is pretty variable from one person to another, I think there are probably different explanations for different people as to why they acquire depression and anxiety disorders.
So how does a healthcare provider go about determining if depression and anxiety are caused by MS, or are they separate conditions?
So, practically speaking, I'd say we don't usually attempt to work down that path, because once the depression or anxiety disorder has appeared, what we do with it is really the same. And it really takes on a life of its own, whether it was out of the disease or having difficult circumstances at home or something else. So I think the main goal, in my view, is that we identify it when people are experiencing it and then provide people with access to effective treatment so that we can limit the negative impacts on that person's life.
You were part of a recent study that found comorbidities like diabetes and high blood pressure don't really influence someone's commitment or persistence with sticking to their disease-modifying therapy. The study did find that having a mental health disorder could lead to discontinuing a DMT sooner. What's the takeaway here for people living with MS?
Well, so I think that for me, the marker is that if you are struggling with symptoms of depression or anxiety, that's really a sign you need to reach out to someone for help with that. Because often when people are struggling with those symptoms, it's very hard for them to take care of other aspects of their health. And so we see that in not staying on medication, having trouble continuing to eat well or to exercise or to connect with the friends who keep us well. And then that leads us to a path of like the MS being worse, which then may, make how we feel about, our mood worse, right? So we don't want to get sort of caught in that cycle. So I think it's just a marker of like, ask for help as soon as you need it. And if you don't get that help from the first person you talk to another person and ask again, so that we can really try and get in there early before these other things begin to happen.
Could you share some common pharmacological and non-pharmacological treatments for depression and anxiety?
Sure. So for the most part in MS, when we're treating depression and anxiety with medications, we're using the same medications that you would if you didn't have MS. So we rely a lot on the studies in the general population. So antidepressants we use, but I have to say we also know that non-pharmacologic therapies work very well in MS, and actually in some situations will be more helpful because they don't have the drug interactions or side effects that you might have if you're already taking a number of medications for your MS. So different kinds of therapy. So we have a type of therapy called cognitive behavioral therapy. So that's a type of therapy that helps us think about reframing our thoughts about things, as well as helping us think about using strategies around sort of getting moving to help with mood. Counseling and support can also be helpful. And one of the small benefits of the pandemic, if we can find a little silver lining in there, is it has moved people forward into developing more online programs for these kinds of counseling-based support so that people can access these therapies perhaps better than they could pre-pandemic. And then we know like simple things like just we'll call sort of activation. So going for a walk and being active and interacting with other people. We're humans, so we benefit from social interaction. So those engagements are also really important to helping with our mental health and keeping us well.
As you pointed out, paying attention to overall health and choosing healthy lifestyle behaviors can help manage comorbidities and lower someone's risk of developing them. We have a question from David who wants to know whether being overweight impacts MS or coexisting health conditions.
It does. So being overweight or obese increases your risk of a number of health conditions. So it can increase your risk for high blood pressure, diabetes, high cholesterol. We also recognize it has some effects, it looks like, on MS in terms of our brains all start to shrink once we get into adulthood. And faster in MS than in people without MS, but obesity seems to accelerate that process. So it's sort of has a multiple impact effect. And being overweight and obese also increases your risk, for instance, of having what we call fatty liver. So it turns out our fat tissue doesn't just sit where we can see it, but it also goes into the organs that we can't see as well. And that gets to be a problem if you need to take medications for your MS that might affect your liver. So again, we want to minimize as much as possible the challenges in terms of managing the MS.
Janelle is wondering what role nutrition plays in MS and in comorbidities.
So I think nutrition is really important. So nutrition is hard to study, right? Because you have to get everybody to adhere to a diet. And so when you put people in a study, unless you actually give them the food, it's hard to know if they're actually eating what you've asked them to eat and those kinds of things. So we don't have quite the same information about diet as we do, say, for specific medications, but we have gathered information that does tell us that diet plays a role. In a recent study funded by the National MS Society suggests that generally healthier diets help us with things like fatigue. For conditions like high blood pressure and high cholesterol and diabetes, there's lots and lots of evidence that tells us that nutrition is really important. So one of the things that I like to do, and we're really lucky in my clinic, we actually have a dietitian who's part of our team. So that's a really great boon, because when somebody comes in and says, listen, I've been diagnosed with diabetes or high blood pressure, I can get our dietitian involved. And so she can teach them about the diets that can help with those things. So simple things like adding ground flaxseed to your diet can actually help reduce your blood pressure and deal with your constipation related to MS at the same time. DASH diets are helpful for heart health and also good for the brain. So there are, I think, lots of opportunities to eat a healthier diet that can be good for both MS as well as preventing and treating other health conditions.
Are there any other wellness strategies that people with MS who have comorbid conditions should be considering?
Well, I think being physically active is also very important. So even if you have difficulty walking, even doing seated exercise programs in a chair have benefits. So I really encourage people to keep moving in some way. And for people who are busy because they're driving their kids to soccer and hockey and running around with life activities, I still think there are ways to fit it in, even if you're not blocking it in as exercise. So I like to think about it as just being active. So can you park your car 5 minutes away from where your destination? So you get a short 5-minute walk in while you're going to do your errand. If you are watching your child at their hockey game, you can walk around the rink, still see all of the action that's involved in their hockey practice or their game, but you get your activity in there and you haven't had to block out any extra time for that. So I encourage people to think about just how can you keep moving, doing something that you like and will stick to, and fit it into your life so you don't regard it as a chore. And I think it's also really important you block in your you time to take care of you on your calendar before you block in all the stuff you're doing for everybody else in the world, because other people's stuff swallows up your calendar like that.
Well, you've shared some really helpful insights with us about comorbidities and MS. What would you say are the top 3 takeaways that you'd like our audience to remember?
So I think the big things would be, make your list so you're keeping track. Make sure all your providers know what they are. Make sure you have a clear idea of what those healthy habits are that you can do and how you can apply them to your different conditions. I mean, being active covers many conditions. So simplify life as much as possible. And if you are being offered a new treatment or approach, do ask the question about how this affects your other conditions. And is there anything that should be done differently for you because of the other conditions that you already have? So basically ask how your treatment plan can be tailored to you.
Well, thank you for sharing your expertise with us today. We have time for 1 or 2 more questions from our viewers. We heard from Marshall, and he'd like to know whether disease-modifying therapies play any sort of role in developing comorbidities.
So that's something that is a relevant question. So there are some disease-modifying therapies that in the clinical trials may increase your risk of other health conditions. So if you're taking fingolimod, for example, the recommendation is that you monitor people's blood pressure because it does look like that may increase a little bit over time. And so that needs to be evaluated. teriflunomide may also affect blood pressure. We worry about with a number of our medications that suppress the immune system. If you're taking them for a long time, there's always been a question about whether that increases the risk of cancer. We've been lucky so far that we haven't really seen dramatic effects in that regard, but it's something to think about and pay attention to. And so clinical trials are following small numbers of people. So usually to figure out that kind of question, we need to wait until the medications are used in more people and for longer. But I think because we recognize these are potential questions, researchers are trying to put together strategies for figuring those things out by looking at health records for many millions of people so that we will know what to tell people and be able to answer that question in more detail over time.
Lexi told us that she's 35 years old. She was diagnosed with MS 5 years ago. She says she eats healthy, she exercises, but she smokes and she drinks socially. And Lexi's wondering how much of an impact her smoking and drinking can have on MS.
So smoking has a number of impacts on MS. So if somebody who has their first symptom of MS, so the first potential attack, even before they get diagnosed with MS, individuals who quit smoking have a longer time before their second attack or the MRI that shows they meet the diagnostic criteria for MS than the people who keep smoking. So that's one sort of important piece. And then once we know you have MS, individuals who keep smoking tend to have a more rapid worsening of disability. They also accumulate more new lesions or areas of damage on their brain MRI, and their brains tend to shrink faster. So I think there are a lot of impacts. Yes, it's easy for me to say quit smoking, but I do encourage people really as soon as they're diagnosed to quit smoking, because I think there are benefits that you can acquire, and there are resources available to help people with that. There's been much less attention about alcohol and the effects on MS in terms of overall disease progression, but I do think we need to think about, people who consume more than the sort of what's considered safe daily limits of alcohol, for example, are at increased risk of acquiring things like cancer. It can increase the risk of other health conditions. If you're taking medications that can affect your liver, may make you more likely to have those kinds of side effects. So, and if you're somebody who has problems with, say, balance, for example, from your MS, you may be more sensitive to the effects of alcohol than somebody who isn't. So I think there's some pretty complex ways in which alcohol can affect somebody with MS.
Well, I want to thank everyone who submitted questions, and thank you for being with us today, Dr. Marrie.
Thank you for having me.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways for you to get involved, and upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Marrie for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and on YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now, I have a quick favor to ask each of you. Getting your feedback on today's program is important, so you'll see a survey pop up in a moment when we close out the webinar. If you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section, and on YouTube, You'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Ruth Ann Marrie and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.